The human spine is an incredibly complex and interesting structure, and we expect a lot of it. We expect the spine to transfer forces, give it structure and stability, defend the spinal cord and permit motion in all planes of motion. And to top all that off, we somehow expect it to never get hurt or damaged. Because given everything we expect from it, it is no wonder that just about everybody has back pain at some time in their life. For some people, it is a mere nuisance. For others, it is utterly crippling. During this session, we will consider the most frequent explanations for back pain. That means muscle strain from throwing out your back, bulging discs, sciatica, and degenerative changes that occur with increasing age. We will also examine some steps you can take to prevent and control these phenomena. Trust me, it will be a vertebral one. Spinal anatomy, the backbone, also referred to as the vertebral column, consists of 33 vertebrae bones divided into 5 segments: cervical neck, 7 vertebrae thoracic chest, rib cage, 12 vertebrae lumbar, lower back, 5 vertebrae sacral, 5 fused vertebrae forming the sacrum coccygeal tailbone. Typical 4 fused vertebrae encircling the spine are several muscles, such as the erector spinae group, that maintain us standing and moving. Between the vertebrae are intervertebral discs, shock, absorbing pads of fibrocartilage with a soft gel-like center. They, along with adjacent nerves, have a significant part to play in both everyday function and back pain. Problems can occur with bones, muscles, ligaments, discs, or nerves. And while rare, back pain can also signal something serious like cancer, infection, or referred pain from organs. But today, we'll focus on the common, non-life-threatening causes. Muscle strains and ligament sprains. The most common reason for back pain is a muscle strain or ligament sprain. This tends to occur suddenly, perhaps after a weekend of mowing the lawn or even a poor night's sleep, overstretching or tearing the soft structures that stabilize the spine, causes pain and stiffness. For instance, the erector spinae muscles trace down the spine, keeping you upright. They consist of 3 components: iliocostalis, longissimus, and spinalis. Remembered with the mnemonic "I love school." Ligaments such as the supraspinous and interspinous support the spine, but strained, small tears and inflammation lead to signals of pain. Typical culprits: poor posture, slouched shoulders, forward head, slouching, sudden awkward movement, such as slipping on ice, repetitive stress on jobs or sports. Inactive supporting muscles due to lack of use symptoms typically consist of acute pain in the lower back, stiffness, and spasm. It may mildly radiate into the buttocks, but is usually local. The good news, most of them recover in 4–6 weeks, although neglecting them can develop into chronic conditions. Herniated and bulging discs, approximately 20–30% of episodes of back pain are due to disc issues. Every disc contains a soft nucleus, the nucleus pulposus, and a fibrous outer wall, the annulus fibrosus. Over time, with wear and tear or trauma, the annulus becomes weakened, and the nucleus can push outward, resulting in a bulging or herniated disc. If the bulge compresses a spinal nerve root, you have a double whammy: disc pain and nerve pain. This most commonly happens in the lower lumbar discs, particularly between L4 phase L5 or L5 phase 1. Sciatica, when a herniated disc presses on a nerve root that contributes to the sciatic nerve, it creates sciatica. This enormous nerve, the largest in the body, is composed of roots from L4, L5, S1, S3. It travels under the hamstrings, dividing into the common peroneal nerve, front of the leg phaefoot, and tibial nerve, back of the leg phaefoot. Since it is carrying both motor and sensory fibers, sciatica may result in shooting pain in the leg and foot from the lower back, numbness and tingling, compression of sensory nerve, weakness of specific muscles, compression of motor nerve. The specific symptoms vary with which root is compressed. For instance, L4 compression appears different from S1 compression. Experienced practitioners can frequently identify the involved level without an MRI by utilizing dermatome maps and muscle testing. Risk factors for disc problems: aging, Discs become dry and brittle. Obesity puts pressure on the spine. Smoking reduces nutrient flow to discs. Poor ergonomics, prolonged sitting in bad positions, injury, sports, or improper lifting techniques. Degenerative changes. The final common cause of back pain is degeneration, such as osteoarthritis and disc breakdown. Over 50% of people over 60 have some form of it, but it can begin earlier, especially after injuries. Evidence is worn down discs, wedge-shaped vertebrae, and loss of cartilage in facet joints, the small joints connecting vertebrae. Osteoporosis and other such conditions speed up the process, occasionally resulting in kyphosis, the stooping back posture. Even natural degeneration that comes with age can be slowed down or accelerated by lifestyle factors. Prevention and treatment. The best thing to do is prevent it. Important strategies are: stay within a healthy weight range to minimize spinal stress. Use a supportive chair with adequate lumbar support. Readjust your workspace. Monitor at eye level, feet flat on the floor, thighs parallel to the floor. When possible, utilize an adjustable workstation to switch from sitting to standing. When lifting, employ the breathe and brace technique. Breathe in deeply. Brace your core. As if about to receive a punch, grasp the object while continuing to maintain the brace. Exhale when standing upright. Exercise for back health. Exercise is not just necessary to treat back pain, but to prevent it as well. In addition to daily resistance training, commit to 5 Phaeton minutes of core training after every workout. Planks and variants. Phae engage obliques and transversus abdominis. Superman's Phae back. Extensions. Phae work on extensors. Mobility drills. Phae ensure the spine is mobile in all planes. Forward Phae back, side to side. Rotation. Practicing yoga or Pilates involves these movements naturally. Don't forget the hips and glutes, tight hip flexors. Psoas major, iliacus and weak glutes. Phae hamstrings can derail spinal alignment. Sitting all day shortens hip flexors, resulting in postural issues and even dysfunctional glutes that fail to activate. Effective corrective exercises are split squats. Phae strengthen front leg. Lengthen hip flexors in back leg Romanian deadlifts. Radials. Phae strengthen hamstrings in a lengthened position. And train back extensors, hip thrusts, Phae glute bridges. Phae reactivate and develop glute strength. Try to incorporate these into your lower body training twice a week. I hope that gave you a good sense of the spine, the most prevalent reasons for back pain, and most critically, what you can do to avoid and deal with it. Take care of your spine, remain active, and thanks for watching and supporting our channel.